social determinant of health that we'll be focusing on for this video is economic status. There are many ways in which financial resources impact health outcomes within a community. The first is geographic location or environmental factors. Human health can be influenced by many factors, including exposure to physical, chemical, biological, and radiological contaminants in the environment. Research has established a relationship between exposure and disease for some environmental contaminants, including radon and lung cancer, arsenic and cancer in several organs, lead and nervous system disorders, and disease-causing bacteria such as E. coli and gastrointestinal illness and death. Air pollution is commonly linked to asthma, cardiovascular disease, and chronic obstructive pulmonary disease. According to the National Institute of Environmental Health Sciences, poorer communities tend to be exposed to a higher concentration of air pollution compared to richer communities. On a global level, research underscores the importance of social class when considering the unequal distribution of air pollution. Low-income households may not have the economic resources required to move to an area where the air quality is improved or less polluted. That brings us to our next limiting factor, which is the lack of access to nutritious food in low-income communities.
In addition to all that was mentioned previously, areas with higher levels of poverty are more likely to have food deserts. Food deserts are an area where people have limited access to and scarce availability to acquire healthy and nutritious foods that are affordable for their fixed income. In 2008, the USDA attempted to combat these food deserts through implementation of the Farm Act. When this act was put into place, it was determined that 23.5 million Americans were living in an area directly affected by food deserts. This number has likely since doubled then in 2022. Not only do food deserts directly affect the economy such that individuals can no longer afford to purchase food, it taxes our healthcare system because more individuals may suffer from malnutrition due to lack of food or obesity due to an abundance of unhealthy foods. Overall, access to adequate foods and nutrition play an extremely large role in the economy as a social determinant of health. When individuals do not have access to the proper fuel for their bodies, it results in development of chronic illness and disease, requiring extensive medical attention. Medical care in the United States can cost individuals up to $50,000 a year without adequate insurance.
In a variety of contexts, lower socioeconomic status has been shown to be associated with reduced access to medical care, increased poor health outcomes, and increased mortality and morbidity as individuals age. Some of the barriers which limit access to medical care in lower-income individuals include a lack of education, complications with health insurance, and a distrust of healthcare providers. In turn, it has been proven that inadequate or inaccessible medical care further exacerbates increasing healthcare costs due to factors such as increased emergency room visits. In addition to limited access to medical care, lower socioeconomic status is also often associated with limited access to proper education.
Not having access to proper education is another disadvantage for those with lower socioeconomic statuses. With societal expectations, a lack of education is often associated with the inability to learn and a lack of initiative. However, more often than not, it is the inability to access the resources and pass the barriers that impede individuals from pursuing a higher education. Something we need to ask ourselves in our communities is whether intervention is possible to be more inclusive of those who desire higher educational opportunities but are not able to pursue them due to their lower socioeconomic statuses, and how we can create opportunities for this population. By considering the factors that affect access to education and creating a foundation upon which those individuals can access higher educational opportunities, people with lower socioeconomic statuses can be propelled towards greater success academically and career-wise. This can also benefit them in the long run in gaining access to resources regarding their own healthcare and being educated about their healthcare later in life, playing a part amongst the other factors that are important when it comes to breaking down economic status as a social determinant of health.